Yes, Yuveka, we are here at the Rahima Moosa Hospital, and we're about to speak to the CEO, who's just going to give us an overview of some of the challenges that have been brought about by the shortages of water at the hospital. Here is Dr. Nozugo Mkabai. Ma'am, if you could just summarize when this issue started and what some of the challenges have been that the hospital has faced.
Good morning, and good morning to the viewers. Thank you for the opportunity. The problem started on the 19th of May this year, 2021, and today is the 2nd of June. The problem has been a problem with Rand Water and Johannesburg Water with their infrastructure problems. And this past weekend, there was a problem with electricity that compounded the problem. Challenges have been both clinical and general. So I'll start with the clinical challenges. The clinical challenges have been the fact that we are not able to wash hands. The staff is not able to wash hands because we do not have water in all the areas. So when we do not have water, because we do have instances when we don't have water, there's a system where Joburg Water trucks come into the hospital and they pump the water into our system, and that it goes via a mechanism where it then goes up to all the levels of the hospital, up to the 4th floor where our operating theatres are. And they also pump water. We have JoJo tanks that are on the premises, and they pump the water. They take the water and put the water into the JoJo tanks. But now the challenge with the JoJo tanks is the water from the JoJo tanks, the staff and patients cannot drink. So we use that water mainly for washing of hands, as well as our ablution facilities, our toilets, to flush the toilets. So we have had a problem that we cannot have drinking water. So we've had to ask for donations for drinking water. In terms of our patients' operations, we do not use tap water, even if we do have water for operations. We use sterile water, medical sterile water. So the operations in terms of water have not been a problem. But there has been a problem in the sense that our operations for the whole hospital in terms of seeing to patients have been delayed. Because as you can imagine, with water, it takes time to do what we are meant to do as a hospital. So that's the clinical problems. And then for general problems, we obviously have got problems now that the staff have to manually carry the water from the JoJo tanks up to the floors where it's needed. Of course, we use lifts, but it's still, there's some manual labor involved when they take the water and put it on a trolley and take it to a lift to where it's needed. So staff have been experiencing extra strain. And also our kitchen was affected on Monday because of the electricity issue now. We didn't have a problem with the kitchen, but on Monday there was a problem because there just was no water in the area whatsoever. But because of the generous donations, we have been able to cope.
Doctor, it seems as though it's a very desperate situation, and now we're seeing an NGO having to step in. I understand the hospital has given them permission to try and drill for water. What kind of relief will this bring?
This will bring a huge relief, and not just for the problem now, but for future problems, because I've been following the news, and the water crisis is nationwide. It's not just in Johannesburg, it's not just in our area. So I've been told by Gift of the Givers and my facility manager that this borehole that they're drilling here, and they've been very generous, because I also asked them if they could help our sister hospital next door, Helen Joseph. And I got a message this morning from the founder, Mr. Imtiaz Suleiman, through one of our senior clinicians, that he's agreed, and we're very grateful. So it's not a borehole that's just going to assist Rahima Moosa Mother and Child Hospital. It's going to assist the whole area in terms of having water when there are water crises again.
Doctor, we're seeing a lot of reports around patients who are seemingly finding issue with the care that they are receiving at the hospital. Is the hospital overburdened, especially since it's now having to assist with the issue of Charlotte Maxeke remaining closed for now?
The hospital has been experiencing challenges, obviously, because Charlotte Maxeke has been on the premises since the fire occurred mid-April. So we are getting Charlotte Maxeke patients. We're not the only hospital that has received Charlotte Maxeke patients. All the hospitals in the Charlotte Maxeke cluster and even some beyond our cluster in the Gauteng Department of Health have taken the extra load of patients. But those patients have come with their own staff, in terms of clinical staff, in terms of general staff, in terms of allied services. So we do have staff to attend to those patients. But there has been delays because if you're used to seeing, I'll just make an example, let's say you're used to seeing 100 patients on any given day for a particular clinic. Now you have to see 150. So obviously there are going to be delays, but we have not turned any patients away. We have not closed the hospital. We don't have an intention to close the hospital. I've spoken personally to other CEOs in our Charlotte Maxeke cluster, because we are a cluster of hospitals, and even beyond the cluster, for our other hospitals, sister hospitals, and even Discover's Clinic, because Discover's used to be a hospital, it's now a community health care center that does deliveries, and so they are assisting us in taking some of our uncomplicated patients. And we are working with other CEOs to say even our clinicians, our obstetricians and gynecologists in particular, are going around the different hospitals so that if the patients are transferred there, then our clinicians follow the patients there. So it is working, but it's not ideal.
Yvette, I just want to bring in Gift of the Givers just to give us a few words in terms of the processes that are unfolding on the ground right now. Emily, if you could just give us a sense of where the process is right now. I know drilling started quite early this morning.
So, good morning, everybody. So, yes, we are still in the process of drilling, and it seems to be going well. So, hopefully, God willing, soon we will see some water coming through. We're already seeing little bits of water seeping through, but hopefully, later today we will have water at Rahima Moosa.
And we know, of course, you've been providing some relief in terms of ablution facilities and bottled water. Is that process still unfolding? And are you getting any assistance from the provincial department or the municipality itself?
We are still delivering bottled water to the hospitals, not just Rahima Moosa, but also Helen Joseph Hospital. And also keeping in mind that bottled water, it's not a long-term thing, it's a day-to-day thing, and it can't sustain people. And for us being here, it's just to drill the borehole is long-term sustainability for the hospital. And no, we're not getting any help from the municipality. We are doing this entirely on our own as an NGO, and we hopefully be able to support the community.
Are there any questions from any of the other media houses?
Hi, Doc. Rianti from ETV. I just wanted to know, in terms of your COVID patients, seeing that we're seeing a peak that's rising steadily here in the province, how are you guys coping? Because obviously other operations need to continue as scheduled, as normal. There'll be patients coming in for other related issues. So how are you coping in your COVID wards? Have you reached capacity yet?
Okay, good morning. Before I answer that question, I'd like to add to what Emily said, that in terms of donations, we have had, yesterday we had 20 mobile toilets, because we're not just getting water, we're also getting mobile toilets. So Bidvest donated 10 mobile toilets when the problem started on the same day or a day later, and yesterday we got 20 mobile toilets from Johannesburg Water, and we're grateful for that. And we've had other donors, private donors, and I must also commend my staff, even my junior doctors, my interns. In some departments, every person is bringing a 5-liter bottle to the hospital for their own use. So I think the pulling together that people have done is quite commendable. In terms of COVID patients, we are in a way fortunate in the sense that we are a mother and child, regional mother and child hospital. We attend to obstetric patients, gynecological patients and pediatric patients. So those 3 sets of patients are patients that generally we do not see, even with all the first, second and third wave. They are not patients that we see a high number of COVID patients with. It's usually the medical patients that are attended to by physicians that in the bigger hospitals that have physicians on the premises and with their disciplines that attend to COVID patients. So we do have some COVID patients. We have noticed in the last 2 weeks that there's been a slightly increased number of COVID patients, but our COVID wards are certainly not full. We've also seen a little bit of more staff because we also have an occupational health center on the premises. So in the last 2 weeks, we've had more staff being diagnosed with COVID, but fortunately, most of our staff have had vaccinations, so they are generally isolating at home. So it hasn't been a big problem for us.
All right. Thank you so much, CEO. I see another question from another media house. You can.
Morning, Doctor. Jill Giffey from the Sunday Times. I've just got 2 questions. One, with the challenges of not washing hands and all of that, have you seen a rise in infections in the hospital? And secondly, what has the impact or the financial impact been? How are you managing the costs of it?
All right, thank you. I think I need to correct that we are washing hands. All staff is washing hands. We are using sanitizers, but sanitizers do not get rid of bugs, especially hospital bugs. They will not get rid of all the bugs. So hand washing with soap is still superior. So the water that we get from the JoJo tanks we use for hand washing. We have asked our clinicians, obviously, to be on the lookout, as they normally do, for infections, which they normally do for patients. They do take cultures. We've got an environmental health officer on the premises who's even been taking samples from our JoJo tank and looking out for such outbreaks. There's not been a reported outbreak yet of infections, but we're very much well aware that such a water crisis could lead to such outbreaks. And in terms of the financial impact, yes, there is a financial impact because we cannot just rely on donors for water and mobile toilets. So we've had to also procure from our own budget and such for our patients.
Thank you, Doctor. I think that's where we can leave it for now, Yuveka. That is the latest coming from the Rahima Moosa Hospital here in Johannesburg.